All right, you guys, so this is special population considerations. This is part two. So, exercise recommendations should always reflect the client's needs and abilities. Older adults often benefit from combined balance, strength, and flexibility training. Athletes may require sport specific mobility exercises, while individuals recovering from injury should progress gradually under professional supervision. So, older adults, they benefit from more combined exercises, balance, strength, and flexibility training. Fall prevention is critical in progressing slowly and monitoring fatigue carefully. Neurological disorders, conditions like Parkinson's disease and stroke impair sensory integration and motor control, requiring specialized balance with clinical oversight. Athletes also require sport-specific mobility, work targeting joint demands of their activity, using a PNF or dynamic methods more aggressively. Post rehab or arthritis, patients suffer from arthritis. They often have range of motion limitations and pain, which must be guided through progression. Gentle pain-free stretching and supervised balance training are foundational for their recovery. Applying assessment results. So, assessment results guide individualized exercise prescription. Clients with reduced hamstring flexibility may benefit from more targeted stretching, while poor balance scores indicate the need for neuromuscular training and fall prevention strategies. Reassessment allows practitioners to evaluate progress objectively. So they develop some SMART goals, which is specific, measurable, achievable, relevant, and time-bound goals that the client understands and that the client can use through the process. And then they monitor their progress at 6 to 8 week intervals to evaluate program effectiveness and adjust recommendations accordingly. So the next case study is a 68-year-old with poor single leg stance performance and reduced hamstring and lower back flexibility, with no active medical conditions, but physically inactive over several years and motivated to improve independence and reduce fall risk. So the individualized program design is a light aerobic exercise, 20 to 30 minutes, 3 to 5 days a week, to improve the aerobic base and improve the warm-up quality. Also recommend some lower body stretching, chair squats, calf raises, hip exercises to build the muscular foundation and improve balance. Static stretching, hamstring, hip flexors, calf stretches, hold for 30 seconds, 2 to 3 repetitions. Progressive balance training, so begin with double leg stance and progress with single leg or tandem stance and unstable surfaces over a stretch of 8 weeks. Key takeaways. So the 4 principles anchor everything discussed across the 3-part lecture. Return to them when designing assessments or provide prescribing interventions in clinical or fitness contexts. So flexibility supports joint and motion. Adequate range of motion enables efficient movement, better posture, and functional independence, especially as clients age. Balance reduce fall risk. Neuromuscular training and progressive balance challenges directly reduce fall risk rates and the fear of falling in older or clinical populations. Assessment guide prescriptions. Valid standardized assessment results are foundation of individualized based programming. And safety is essential. Safety is essential to the client. Safety is essential when you are performing your assessment sessions. Here are a few review questions. So, which three sensory systems contribute to balance? So, in this, we want to think about the brain source of information, postural information. So, these are the three: the visual, vestibular, and somatosensory systems. Question 2, which field test primarily measures hamstring and lower back flexibility? So we want to consider the assessment where we use the box or the ruler and we extended both legs. This is the sit and reach test. And question 3, why should clients complete a warm-up before flexibility testing? So think about the effects, the physiological effects of increased muscle temperatures on the tissue. So warmer muscles are more extendable, improving both safety and measurement validity. Flexibility and balance deserve equal priority. So these components influence mobility, performance, injury prevention, and quality of life across the entire lifespan. So from the sit and reach test to the Berg balance scale and to static stretching to other exercises, evidence-based assessments, and prescriptions in these domains are essential skills for every exercise science professional. Thank you.